So guys, I've already made a video explaining the difference between Bell's palsy related facial paralysis and the stroke related facial paralysis. These two conditions are absolutely different, and hence the management of these two problems is also very different. In today's video, we are going to discuss how stroke related facial paralysis needs to be managed with the help of physiotherapy. So make sure you stay tuned with me till the end of this video. I am physiotherapist Meghana and welcome to the YouTube channel HealthQ. Now coming to today's topic is stroke related facial paralysis. Now starting from the reason why stroke related facial paralysis happens to the management of it. Everything is different, absolutely different from Bell's palsy. Even the symptoms are also different. Although Bell's palsy and stroke related facial paralysis both are paralysis of the face that affects similar areas, there is a lot of difference in the way the patient will present the symptoms. For example, in Bell's palsy, absolutely one side of the face would be damaged. On the contrary, when it comes to stroke, only the lower fourth part of the face would be affected. In Bell's palsy, the muscles which are paralyzed are on the same side of which the facial nerve is damaged. But in contrary, in stroke-related facial paralysis, stroke has happened on the right side of your brain. The facial paralysis will happen on your left side. And that's the anatomical, or I'll say pathophysiology behind this problem. Now, I'm not going to explain you here what's the pathology behind the stroke related facial paralysis, but what I'm going to talk about in today's video is how different the management and how different the symptoms a patient suffering from stroke related facial palsy has. Bell's palsy, the paralysis of the facial muscle is flaccid. Now what do I mean by flaccid is there is no tone or else no kind of tension that's present on the facial muscle. On contrary, in stroke-related facial paralysis, mostly there is an increase in the facial muscle tone, which means when you touch the facial muscles, they seem to be more tighter, more tensed, and hence it leads to difficulty in performing the movements of the facial region. Even the patients suffering from stroke-related facial paralysis have this problem of loss of taste sensation. Even though their forehead function, eye function is absolutely normal, they might not have that repeated drying of eyes and tear coming out or else difficulty in closing their eyes. But yes, they will have a lot of eating and swallowing difficulties. Like they will have problem with sucking, they will have problem with swallowing, and even they will have the drooling problem. Now since the management is mostly related to exercises, and exercises plays a very crucial role in terms of managing stroke-related facial paralysis, the goals here are different. The first goal that comes in mind of physiotherapist or else in the planning of physiotherapist is to control the muscle tone as much as possible. Since increase in tone impairs the movement quality, it is very important that the therapist try to control the facial muscle tone as much as possible. Now there are many techniques with the help of which the facial muscle tone can be normalized. It could be in the form of facial massage, it could be in the form of activation of the muscle spindle like with the help of ice cube massage, or else sometimes just stretching of the facial muscles. But here it has to be more gentle and more repetitive. Absolutely contrary to Bell's palsy related facial stretching and facial massage. Secondly, electrical stimulation is kind of avoided since it could lead to synkinesis in Bell's palsy situation. But in facial paralysis, since it's an upper motor neuron disorder, which means it's a central problem, the problem is existing in the brain, the nerve has not damaged here peripherally, electrical stimulation can be actually extended to more time. And instead of just focusing on activating individual muscles, in late stages, the therapist can also choose to activate the group muscles, especially keeping in mind the tone. Tone has to be normal as much as possible. Electromyographical feedback, or else say biofeedback, is a most important technique when it comes to management of facial paralysis related to stroke. What here it's done is these feedback is presented in a graphical form which enables the patient to have a look whenever he or she is trying to make those facial movements. This feedback will help the patient to initiate the movement which is diminished. They can also take the help of activating the normal side and then imitating that particular movement on the affected side. The next thing that physiotherapy management comprises in terms of facial palsy management is neurodevelopmental technique. Now this particular technique is a very vast topic, and this technique is time tested, proven, and is very widely used by physiotherapists in management of neurological disorders like stroke, Parkinson's disease, cerebral palsy, etc. The same applies to facial palsy related to stroke. The aim again here in neurodevelopmental technique is to lower, or else say normalize, the muscle tone. They use the principles of inhibiting the activated or else tensed muscle, at the same time stimulating the weaker or else deactivated muscles. Facial muscles and facial movements and expressions are manipulated with the help of therapist's finger in the direction of correct movement pattern. So the focus is very much on the movement technique as compared to initiation of movement that is present in Bell's palsy treatment. Focus is more on eating ability and pronunciation, which is hampered due to slurred speech and increase in tone of tongue and cheek muscles. Recurrent touch-based therapy, which is called as Roots approach, it's a technical term commonly used by physiotherapists where different textures of substance are exposed to the patient in order to activate the paralyzed areas and bring the normal movement as soon as possible. Since the management of facial paralysis related to stroke can go little more longer compared to Bell's palsy, patients and therapists needs to be very patient, at the same time have to have an optimistic approach and set realistic goals. It's very important that patient and physiotherapist work in collaboration with each other in its management. In upcoming videos, we will talk more about stroke related information on how it is managed in terms of improving the mobility of the patient and also in terms of making patient as independent as possible. If you who are someone who is interested in having information or as knowledge related to stroke rehabilitation, make sure you like this video and don't forget to subscribe to our channel and come back on next video. And you can come back by pressing the bell icon so that you can get notified every single time I upload a new video. On that note, I will see you in the next video. Thank you.